We're going to move into the next two speakers to look at the innovation landscape, which kind of segues nicely from that last discussion we had, supporting innovators through research and funding. So we have two speakers that will address those issues and give some insights into that. The first is Professor Michael Lewis. Michael is a Professor of Life Sciences Innovation at the University of Birmingham and a Joint Director of NIHR, the I for I and SBRI healthcare program. That's kind of a considerable number of acronyms in there, which I'm sure we can get to the bottom of later. Michael has industrial background in life sciences and digital innovation, and he sits on the board of SNOMED. So, which is the global medical coding standardization system that the Executive Board of Birmingham Health Partners and its special advisors sit on with the NHS. So, Michael, if you'd like to join us today, I'll hand over to you.
Thank you. I never realised I had so many jobs. I certainly don't get that many paychecks. It's a pleasure to be here. Normally the sort of lecturing environment I work in and lecture halls like this, it slightly smells more of beer in the morning because they're med students. You get 420 med students in a room at 9 o'clock, it does have that sort of slight after effect. But what I'm going to do today is, actually stuck my new job up there, which is Scientific Director for Innovation at NIHR. Since January I've been looking after all the innovation programs at NIHR. And if I reach an acronym, and I hate acronym-itis, just put your hands up and I'll try and explain them. National Institute of Health Research, if you've not followed that one. It's a leading question, I know, but look, who's the largest funder of life science research in the UK? Do I have to click this to put the options up, or are you going to click it, guys? Thank you. Oh, that one. So who's the largest funder? Anybody? Put your answers into Slido. And let's see whether we get the right answer. Oh, BASE. BASE doesn't exist anymore. It's DSIT. It's Department for Science, Industry and Technology. I managed to trap George Freeman in a revolving door yesterday as he was coming out of the department. I was pushing him one way, he was pushing the other way. Sort of an analogy for government working, isn't it, really? Government. Yes, supposed to. Okay. I think we've got enough answers up there to make a call of it. EPSRC is a good shout, actually. Probably less so, but I was talking really about life science funding. The biggest funder in life science is actually NIHR. It's bigger than the Wellcome Trust. It's bigger than all the other organisations as well. So we've gone to the next slide and drop the slider. Thanks. We're the largest funder of health and care research in the UK, funding everything from therapeutics, medical devices, IVDs, even into the sort of pharma space as well. NIHR, in case you don't know, it's a virtual organisation. There is no place you can go to and knock on the door and deliver your bills to NIHR. We're spread around the country into multiple locations, and I'll show you some of those in a little while. Total budget in 2023 is 1.3 billion. Total budget in the CSR, if you look at it, is we're going to be spending about 1.65 billion. This is part of the commitment to invest 2.4% in R&D in the country. So that's our money that we have, and we split it into certain areas. The biggest area we split it into is infrastructure, stuff, buildings, places. And I'll explain some of those in a little bit, but biomedical research centres, MedTech innovation centres, clinical research networks, clinical research forums, experimental cancer medicine centres. So a lot of it is in terms of places and stuff. But then we layer onto it as well research programs. We spent about $250 million last year on research programs. We're going to be spending more like 400 million in the next year on research programs. Looking at emerging medicines, looking at methodologies, looking at statistics. So there's a lot of program work. And then we have another thing as well, which you touched on before, which is our faculty. We have the NIHR faculty, which is about training doctoral, postdoctoral, professors, etc. So we're adding skills into people, primarily academics or even clinicians who come in, and then we give them training on top. So that's our budget. We also make a contribution to Genomics England, sort of in our genes, really. Try to slide that one in. What's our mission? We're there really. NIHR sort of sits alongside a political agenda. If you cut through a lot of the NIHR people, they're all about working out what is best for the health of the nation. What research can we do that will improve our health? Because we believe quite firmly that if you improve people's health, you improve people's wealth. You improve people's wealth, then guess what? You help improve their health. There's a direct correlation. We do that a few ways. We invest in world-class infrastructure. We try and partner with industry and charities and public bodies and work with organizations like Phil's organization. We support high-quality research. We do really good research. I was asked recently by a minister who I won't name, but he said to me, if you could tell me the biggest thing that you've done in the NIHR in the past 10 years, what would it be? And he was expecting me to sort of go, it's the PROTECT study. The PROTECT study was the biggest single indicator of outcomes for prostate cancer in men, and that study saved thousands and thousands and thousands of men. We also engage and involve with patients and carers and the public. We have a strong theme running through as well about EDI, but also about PPIE, patient and public involvement, diversity, inclusion. So we have a strong theme. Every single one of our panels where we go to fund infrastructure or we fund a program has PPIE representation on it. If you're building stuff and you're building stuff in your environment and you're not involving patients and you go towards NIHR or the NHS or whatever, you will very likely not get funded because you've not included patients. So that's something that you really need to do in the future. What's our offer to industry? We try and work with industry in a range of areas, from early stage all the way through to real world evidence as well. We don't do things like the testing. We just try and guide you along your journey with expertise, with places to do it, help you set up trials, clinical trials, so they meet the endpoints that you're after. We give funding as well. We also give you access to some data resources, that's hard data, bioresources, biobanks. And we work in the direct clinical space, but also in the social care setting as well. And we take you all along that journey, all the way through from a research idea, which may come out of an academic, that we were talking about before, take you all the way through translation and making it into something, define your methodology, get some initial funding, take you the way through your evaluation of your research, and then through to adoption. And that's becoming more and more the aim of people at NIHR as well. We do lots of great stuff, but the adoption of that stuff into the NHS is really quite tricky, especially when you have to go through multiple pilots and you have to pilot everything with every single ICB to get it through, because every ICB is different. No, they're not. So what do we have available? 3 areas: facilities, how to set up trials and make sure you gather the evidence, and then funding for the research. So I'll break those 3 down. Facilities. We have something called MedTech and in vitro diagnostic cooperatives. These are the places you can go to and you can start talking about your evidence that you're going to require. They can help you look at new technologies. They're split by different groups. So if you go to Newcastle, that's the MedTech in vitro diagnostics cooperative for IVDs. If you're talking about doing something closer to home, closer to here, to Birmingham, and you're looking at something which is in the trauma management space, you can talk to them over there. They will start to put you down the path and tell you what sort of evidence you're going to need to gather, but also tell you as well what evidence you're going to need to gather so it's valuable for the NHS. They're a free service. You've got that backed by the Clinical Research Network. There are 15 of those across the UK that run different specialties. Once again, if you're going to do something, let's say, in stroke, you're going to want to probably go to the one in Oxford. If you want to work, let's say, in cancer, then you probably want to go to, neuro, let's say you're going to go to Cambridge. They will help you design protocols which will meet your endpoints. They will also help you as well in delivering trials as well, if you want to work with them on that. BRCs, Biomedical Research Centres, these have just been recontracted, about 20 across the country. And these help you, they work on themes, so things like dementia, cancer, healthy aging, pediatrics, mental health, stroke, genomics. Good example, Barts. If you want to do cardiovascular work, then you want to go and talk to the BRC, the Biomedical Research Centre, people at Barts Hospital. And if you want to do ophthalmology, you probably want to go to Moorfields. They're experts at it. But these are also resources and part of that infrastructure available as part of NIHR. And then we have facilities. There's 23 of these purpose-built across the country. These are places which exist, you can go to and you can talk about your innovation. If you want to talk children's, then go to Alder Hey. So these are all listed. If you go onto the NIHR website, you can find all these places as well, and you can work out which ones could possibly be a help. On every single one of those, you'll be given a contact at the bottom so you can access it. Talked about experimental cancer medicine centers, probably less so for this audience, but if you're working in that space on cancer vaccines or mRNA cancer vaccines or anything else like that, you want to work with these guys, and they're also the guys who are going to be working on the new competition, which is about diagnostics for cancer. Some of the other things you can tap into, there's a National Biosample Research Centre, there's the NIHR Bioresource, the NIHR Phenome Centre, and there's also other data we can help you access within the NHS. So if you want to talk about accessing some of the SREs are out there, secure research environments, then these are there's places you can go to on the NIHR website to find this. So that's one, which is infrastructure and stuff. Second area is how do you set up clinical trials? Just some metrics for you. We recruited last year about 1 million people in the UK onto clinical trials. You just see me put a little doodad on the NHS app, so if you want to go on there and sign up to be on a clinical trial, you can do that. If you want to be part of the 5,000 new studies we set up, you can sign up your interest there. And we do about 1,000 commercial studies a year involving about 50,000 people. Then if you look at the NHS, one of the issues has been in the past is capacity within the NHS to do research, but we're building that capacity up now post-COVID. So about 99% of all NHS trusts are research active. And you can see there's a lot of CDAs you sign in terms of getting products done. And once again, these are the people you need to go and speak to. The list is up on the NIHR website if you want to have a look. But these are people you can tap into to do your research. They're skilled people, trained people. They have statistical people, methodological people as well working with them. And there's a whole study support service which you can tap into and use. Then the biggest area probably is funding stuff, money to do stuff. Because if you don't have money, then it's very hard. And there's been so many documents out there, from Life Sciences Vision to Accelerated Access, the NHS Long-Term Plan. There's been so many different things going on there about how we're going to exploit the world and how we're going to capitalize on MedTech and pharma innovations. There's all this stuff that we'd like to do, but then you're going to have to fund it. The funding landscape, if you map the whole funnel of funding landscape across the UK, I know this is a global conference, Mike, but this is just purely looking at the UK, then it's an enormous amount from basic research, from things like the Wellcome Trust. There's 3 or 4 pots to go into, and there's pots if you go into translational, so it's a really complex landscape. And the people at NIHR on the industry side, they're trying to help you navigate this landscape and learn where you can go to for different things. You can see that NIHR works all the way from translation all the way through to implementation and adoption now. I'm going to pick up a couple of these. One is the I4I program. It's a translational funding program, so one of the ones that I run, and we provide funding for breakthrough technologies, and we try to help you collaborate on the R&D. We try to de-risk stuff. So this is a pot of money you can tap into at the I4I. And I4I funding is around about 45 to 50 million a year. And you can tap into the I4I program, but you can also tap into the SBRI healthcare program as well. SBRI healthcare program is around about 40 million on SBRI. There's about another 30 million for cancer, and there was a pot of money for AI, and I think we've got through that pot of money on AI now. But if you want to tap into any of those, and you want to learn more about how you can access the funding industry at nihr.ac.uk, and it'll take you through into a gateway where you can find out more about the funding. But we do, just so you know, this is there are some funding programs out there where you're required to put your hand in your pocket as well. If you're on NIHR funding or SBRI healthcare funding, it's 100% funding. So these are contracts with the government with you to do the research. And you can be academic, clinical, or SME led. It's really targeted towards the SMEs, the ones that Phil was talking about earlier, because most of the medtech industry in the UK is made up of SMEs. It's the same all around the world. So we really aim this towards SMEs. We have experts that can help you navigate your pathway and then show you how to get access to funding. We like risk. We realize, I know it's taxpayers' money, but we like a healthy degree of risk, because if you don't take risk, then you don't discover things and develop things. We provide program managers as well to help you in terms of delivering your project. So far, we've invested about 300 million and awarded people 350 contracts. Sometimes you get people coming back once or twice. Some people go on SBRI, then jump across to I4I. But it's interesting if you look at the sort of measures as well. There's a couple of IPOs associated with people who've been on the program, and there's more to come. We leverage a lot of funding, and we've got quite a lot of people who've gone through the I4I program. And we've involved about 22,000 people so far in the country on projects associated with I4I. So it's a really big program. And how do you apply? 4 areas: PDA, challenge, connect, fast. Different stages through your journey. This graphic is actually on the NIHR website if you need to see it. The big funding program is something called PDA, Product Development Award. They're about 3 years. It's unlimited funding. There is no cap, there is no top on it. If you can justify what you want to spend, then you can apply for it. People apply for 2, 3, 4 million pounds and get funded. We just run a competition for dementia where we funded £10.5 million, went to 6 companies. That sort of gives you a sort of idea of the size of funding that's available. There's nothing we tie companies into with getting equity or exit event funding or anything else like that. It is a funding to do a task and do a job. There's another one down the bottom left as well, which you can see is brand new funding, which is about FAST. This probably ties in with if SMEs are looking for funding to do regulatory work or testing work and answer some simple questions. FAST is an interesting funding. We turn around applications in 6 to 8 weeks. You can apply for up to £50,000 to answer a single project. Projects like, what would be my regulatory pathway to get approved? Simple funding. And success rates. About 14% of people who apply get through and get funded. So people say, if I apply once and don't get funding, should I apply again? And go, yeah, keep firing. Listen to feedback as well. We do a 2-stage, like Adam Tickle's review, we do a 2-stage process where you do an initial application, then get some feedback, incorporate the feedback into your stage 2, and your chance of success goes up. And you can either go to signposting at nihr.ac.uk, or you can go to industry at nihr.ac.uk. Both of those will lead you through. There's a team of people who sit there and filter stuff. They're like email bunnies. They just sit there and work out where to send stuff to, and they know the network inside because it's quite complex. That was your whistle-stop tour of NIHR, who is the largest funder of life science innovation in the UK. Got that one in.
Thank you, Michael. That's I think linking into innovation and then showing those 3 areas of how you help is spectacular, really. We talk about the UK lacking innovation, lacking funding. It's just knowing where to go sometimes to gain that insight. And I think you've given us that today. Are there any questions for Michael? I don't know whether we had any coming in on the screen there.
Number 3, does the NIHR publish details of companies who receive funding via I4I and the amount they receive? A, yes. B, no. We do publish everybody who wins an award, we publish them. So you can go onto the website and have a look and see who's won them. We don't publish funding for every single competition. Most of them we do, but not every single one. Okay, that was one taken off.
I just, you used the word, Michael, if you don't mind, we call it UK.
Yeah.
But what is NIHR's remit only England, really? Because I noticed at your map, there wasn't any of your maps didn't cover Scotland, Wales, or Northern Ireland. So, could a MedTech SME based in Northern Ireland apply to any of these funding routes, for example?
Yes, and my advice to you would be, buddy up with somebody in England, partner with somebody in England, and then there shouldn't be a problem. We've had companies from Wales and Scotland. I'm not sure if I can remember anybody from Northern Ireland, but because the I4I program is all about collaboration, if you are a manufacturer, an SME based in Northern Ireland, why don't you buddy up with a trust or one of the MedTech innovation centres here in England to do some of your work? It's difficult to see the questions with a light sort of shining in your face.
Sorry.
Sorry.
I felt like I was being interrogated. I don't know how you felt.
When,
Just like you.
when working with SMEs and particularly looking at the IFRI, one of the issues had been the length of time from the start of the application process to actually getting the award, which can be 18, 24 months. Has there been any improvements on that? I noticed you got the FAST, which presumably is to sort of fill that gap, but
Yeah, FAST fills that gap for about £50,000, but it's not like a PDA award. PDA awards now are about 12 months. We're running 2 phases, so they run every 6 months. But the whole cycle from you sending in your first application to getting notification that you have a grant is 12 months now.
Okay, we've got a few minutes. Maybe just, yep.
Somebody said, what's the current success rate of award to application for funding? I think I showed a number up there, was about 14%. Yeah? If it answers that question.
I've got someone at the back.
Hi, can I ask a question about the role of SMEs versus sort of clinical academics in the IFRI? Just to what extent do you really need SME leadership or clinical academic leadership? How does that balance work? What's the path to success when sometimes it's, there's clinical leadership and they want to get an SME involved, sometimes it's very much SME led?
About 60% of applications to PDA are from SMEs, and the rest are from academics or from clinical institutions. So it's predominantly SMEs who apply. And
the success rate?
Success rate, we don't publish
it's different
success
for
rate.
those two different groups, if it's SME led versus academic led.
Okay. Do you know what? I don't know the answer instantly to that. I do have the data because I pulled it, because we did a big EDI piece of work as well in terms of regions and different institutions. Can I get back on that one?
Yeah, well,
Yeah.
that's
Yeah.
fine. Could I just close with one more? Michael's desperate.
Yeah.
So, are there any sort of hot topic, any sort of hot areas that you're funding, or do you prioritise funding for specific themes?
Right now, if you look at the OLS missions on things like dementia, cancer, obesity, addiction, mental health, what have I missed out? No, infectious disease is not really one. Respiratory is a category, but not infectious disease, not the AMI side. Respiratory is one, and CVD. Thank you. Pick something in those areas and you've got a better chance of success.
Okay. Thank you, Michael. That's been a very insightful presentation. Lots of useful data there for follow-up as well. So, yeah, thanks for your time, Michael.